Neonate sonography is a very important tool for evaluating preterm and term neonates for intracranial pathology. It is easily available, portable, inexpensive, and safe.
Premature infants are at higher risk for intracranial hemorrhage. Up to 67% of preterm infants has risk on developing intracranial bleed. Other pathologies that can be detected via ultrasound are hydrocephalus, vascular anomalies, and developmental abnormality. Frequency higher than 20 kHz are called ultrasonic or ultrasound. Ultrasound are used extensively in industry and for medical purposes. For ultrasonography, it is a technique of obtaining images of internal organs like kidney, liver, gallbladder, and etc. by using echo of ultrasound pulses. Ultrasonic scanner is used to get those images. In this technique, the ultrasonic wave travel through the tissue of the body and get reflected from the region where there is a change of tissue density, or we call defect. These waves are then converted into electrical signal to generate image of the organ, are then displayed on the monitor or print on the film. Thus, from these images, the internal organ can be viewed.
A baby skull consists of several bones, and there are soft spots called fontanelle. Baby soft spots are covered by a thick fiber layer. These spots are safe to touch and typically close within 12 to 18 months when the skull bone fuse together.
Typically, when we do this exam, we use small transducer because they have a very small footprint and fit within anterior part of neonates. They are also have a pretty high frequency. They go from all the way down from 4 to about 10 MHz. On a very small babies, we can use a linear transducer. We will get extremely high resolution images. We can also see the superficial structure like superior sagittal sinus, superior cortical region of the brain. Normally, the anterior fontanelle is open until about 9 to 18 months of age. This could be open longer in baby who are premature or baby who have increases intracranial pressure. For posterior fontanelle is generally open until 0 to 4 months of age. We obtain our images using coronal and sagittal plane. In coronal plane, we are going to sweep the brain from the anterior to posterior, and we will be looking for circle landmark.
In sagittal plane, the objective is to examine the midline structure for anomalies, usually a ventricle system as well as the parenchyma of the brain.
This is the picture from 1980s. You can see it has very low resolution. You can kind of make out some of the structure like cranial bone and ventricle. This is the model image, and the resolution is just amazing. The benefit of ultrasound is number one, is safe. There is no ionizing radiation. The portability. You can use the ultrasound machine in the NICU, which benefit the baby as they are very unstable, and transferring them down to CT or MRI is sometimes not possible. So we can bring the machine to the bedside and provide high quality imaging right there. The findings are typically reliable. You can diagnose a lot of different pathology with ultrasound. It is inexpensive, especially when you compare it to MRI or CT scan. You can also produce a serial imaging. You can scan the baby every day if you need to see the progression of the hemorrhage or any other pathologies, or you can see the maturation of the neonatal brain tissue.